Good afternoon, ladies and gentlemen who have joined our Dr. Fundi Health channel across the world via multiple social media channels, Facebook, YouTube, Twitter, and my personal websites. Today, we're just reflecting on the COVID-19 pandemic in South Africa and Eastern Cape in particular. Last night, when we received our daily updates in terms of the COVID-19 pandemic in South Africa, our caseload as South Africa has risen to a point whereby, as a country, we have now made it into the top 10 of the most affected countries in terms of caseload, not in terms of deaths, just in terms of caseload. We are in the top 10. We are in good company there, led by the USA at about 3.35 million, followed by Brazil at 1.84 million, followed by India at 850,000, Russia at 720,000. Those countries are our fellow BRICS nations, that is Brazil, India, and Russia. China is missing, which is the country where this pandemic started. And then followed by Peru at number 5 with 322,000, Chile 312 at number 6, Spain at number 7 at 300,000, Mexico at number 8 at 295,000, and then the UK, where Sangha is, at 288,000. And then South Africa at number 10 with 264,000 cases of confirmed COVID-19. Now, if we reflect on Africa, we have the highest caseload in the African continent as South Africa. But in terms of deaths, we have the second most number of deaths after Egypt. So Egypt is number 2 in terms of the caseload, but we are number 2 in terms of the deaths, right? And in South Africa, when you now look at the country as a whole, 4 provinces, 3 of them in the coast and 1 of them inland. Inland, Gauteng, the coast being the Western Cape, Eastern Cape, and KZN. When you put those 4 provinces together, 95% of the cases in the country are from those 4 provinces, meaning the other 5 provinces, they only make up 5% of the cases. And when we zoom in into the Eastern Cape province, it's got 8 districts. Of those 8 districts, 4 districts are actually, classified as the districts that have got, what we call their epicenters, because they've got more than 5 cases per 100,000 cases. And the one that is leading there is the Buffalo City municipality around East London, followed by the Nelson Mandela Bay around PE, followed by the OR Tambo district municipality, which is around Umtata, including the King Sabata Dalingebo, municipality, which is my hometown for my guests, and followed by Chris Hani districts. The other 4 districts are also having cases, but not to the same extent as the other 4. So with that background, I just wanted to paint a picture to say we have a challenge as South Africa. We have a challenge when we look at those 4 provinces, including the Eastern Cape. So the topic of our discussion today, we are going to have a conversation about challenges that families experience when they have to organize burials or funerals for their loved ones, whether those loved ones have passed on as a result of COVID-19 or any other cause, of death. There are regulations that were promulgated under the state of disaster that make it quite challenging for families to actually send off their loved ones. So my guests today, I've got two guests. My first guest is Dr. Simtandile Toni, who is a practicing medical practitioner in Umtata. He will tell us more about what he does. He is from a village that is called Kokolweni. We normally refer to it as St. Cox. So he's from St. Cox, just outside of Umtata. And my second guest is also a fellow homeboy, Dr. Sanga Khozani. He is a medical practitioner who works in the UK, in Manchester, under the National Health Service there. He's originally from Umtata, like I said, in a street that is called Callaway Street, just opposite the entrance of my alma mater, St. John's College. He used to be a keen tennis player during his days. I'm not sure what he does now, now that he's in the UK. And Dr. Simtandile Toni, I'm told he's also a keen, not just keen, but an active sports person. He's going to tell us about that as well. Ungumtlane, ungusukude, nazo ke iziduko zakhe. So, gentlemen, both of you, welcome to the Dr. Fundi channel. Mangiqale ngawe, Dr. Toni.
Enkosi Butfundile, mandibulele ngelithuba. I will try as much to speak English. I enjoy speaking Xhosa and
No. Ungamixa wena bhuta khona.
Oh, I am aggressively trying to speak Xhosa so that we can start developing the language, especially medically, because in not speaking the language, we are losing a lot and other languages are developing ahead of us. So whenever we have trouble with the Xhosa English medical term, we try and find a term. So this is why most times, especially in settings like this, so that we can reach other people who will assist us develop our language. Otherwise, we're going to lose the language. Because there's new terms. If you see English is developing, there's new terms now, entanglement, it's a relationship status that is coming into this. But our language has become static. So we must try as much as we can. But briefly to introduce myself, I am from Ekokolweni and everything that I know comes from that place. A short story about me comes from my name. My name is Simtandile, and the name says we have loved him. So it's not that Siyamthanda. So my parents, I always say they gave me that name to say, their part is done. They gave birth to me, they loved me as a child, and then they gave me to the community. And then the community has loved me. And then the community of Ekokolweni has given me to the community of Umtata. And I'm lucky that many people have loved me throughout indawo endizambileyo. And as a result of the love I felt from Ekokolweni, I always felt I was one of the most fortunate people at Ekokolweni. Everyone loves me. I didn't know why, until I realized that they love everyone was Ekokolweni. I always thought I was special. And I realized that it's a community thing. We grew up in a community where people loved each other. As a result, they related with each other as brothers. There are so many families, yet my dad, may his soul rest in peace. I should say we're in a period of mourning. We're breaking that here because there's a greater need to educate and talk to the people. And I hope my dad forgives me where he is and understands what we are doing. So he would call everyone umzala or umchana. Everyone at Ekokolweni is umzala or umchana. As a result, we grew up thinking we're related to each other. And that is my background. And this is what led to what is happening there. I am leading what I will term a revolution in the health, because I am an advocate for rural health. So we're trying to organize the health system so that our people do not die. Our people are still dying from communicable diseases, which should not be a killer at this time when government has afforded people the opportunity for free services, especially to treat the communicable diseases. But you see that we haven't got a handle on that as yet. So I'm advocating and we're trying to change that system. So when COVID came, we're in the process of trying to sort that out and find a diagnosis, what is really the problem at home, because the 5 common causes of death. I think it's TB, trauma, and communicable diseases, and HIV, and malignancies. So those are national statistics. We're trying to find a way of creating our own data from a Ekogolweni, so that we speak to things as a Ekogolweni. So when the COVID pandemic came, and if you understood the way we have tackled TB, to an extent that now we have MDR and XDR TB. So you always knew that if COVID came into our communities, we're going to fail, because it has a similar transmission as TB. So we made a request early that lock the province, because if it comes into our province, we are going to fail. And these are the reasons that it's failing. The first case is for people who came from outside and came into the province. And we locked, this is personal, it's not proven. I feel we locked the country 2 weeks later, or 3 or 4 weeks later, because we've managed to lock the country. And when we were in lockdown 5, we could have done a lot if we had done that earlier, maybe even remove. But unfortunately, the people, I'm in a position where I'm only concerned about health, but the people who make the decisions have a broader aspects to consider. So I cannot even imagine what they have to go through. Probably they are not sleeping, because there's an economy, there are people dying. So that is my background. And my sports participation, I grew up into a family that played football. Everyone in my family played football.
I was about to ask you, Gqirha, when we were growing up, and I'm sure Dr. Sanqa naye uzawungena, there was a gentleman that we used to respect a lot, okuthiwa nguTitch, you know, Mr. Tony, anama wayemthatha Bushbucks or Tembu Royals or what, but wayengu-Referee. Mr. Tony. Do you remember him, Engos?
UTitch wayengu-Referee.
Yes.
I once did a thread about him, and amehlo asoloko evalekile. I remember, I think it was St. John's College playing either Tuticha or Dek. The rivalry was immense at the time.
Yeah.
So we're sitting behind the poles, Bishop, out in St. John's. Now, okay, we had some tendency of having books and it was in then yeah, so even as a side effect side. So behind the pole. Ikore St. John's would teach our Fatim but in Metipeli, now this then Esabeta George Matu, that's bonus is
that was 1980. That was 1980. So are you related to Teach, Dr. Tony?
Gumni nawe katata wa mutichi mtato because I was with him this morning.
Yeah.
He's the biggest influence. He's the biggest influence in Gogwe sport. He is still active as sporting, more as an administrator.
Yeah.
Referee football, we athletics administrator, tennis, table tennis, soccer. Zonke uzenzile utata mwayisenza netball ne-soccer administrator noba administrator. Abakhulu abam badlalile badlala ibhola bonke, so ndikhulele kwi-environment enjalo ebholeni.
Uzukumbuza uTitch uba uyayikhumbula ngala match.
Ndizambuza, ndizakudibana naye ngomso.
So
gqibezela bufundile.
So when I get e-sport Gqirha ukweyiphi indawo because ndibonile iqokolweni athletics club pha ingaba yakho?
Ayo yami iqokolweni athletics club ufundile yaseqokolweni. It was set up to organize i-race ekuthiwa iqokolweni annual run. Sasingayazi uba kwenziwani xa kuset up, saqala i-run because a few of us bebengaphandle kwase Qokolweni bebaleka Then xa sibuyile nge-whole day, we decided to set up a run for abantu ababuyayo. But yakhula to a level where it became kwafuneka i-organizwe i-club. Then we developed iQokolweni Athletics Club. Fortunately, sakhawuleze sabuyela eQokolweni. And nabantu baseQokolweni bakhini kakhulu ngayo bayithanda. Ama i-club yonolali xa ibizwayo. Singonolali, i-club yabo i-organizer phaa eQokolweni. We're fortunate bayithatha bayilangazelela abantu baphayana, and it's become a small club that is developing athletics phayana. But there's two other avenues that we are trying to develop, because we are trying to develop the area. We're trying to set a model for rural areas that says we can do a lot from the rural areas.
Yes.
We've done MST. It's a sports consulting company.
Yes.
It's trying to develop Payana. We're doing tournaments. We've started an academy. We're setting up an academy so that kids from that place can be in school and play sport. Because growing up, I had a challenge where I had to choose between school and sport. And unfortunately, I chose e-sport and went and left school for 5 years. I left at 4th year. For 5 years. Dijike xa ndina 26 ndibona uba iyaphela ixesha lodlala ibhola. Now I must come back to school. I was playing for Bushbucks ngoko, and I came to school. And I think when I was playing for Bushbucks.
No, that was from 1990 to 1995.
Because I watched Bushbucks a lot. It's a home club. I still support Bushbucks for now. So that is the first one. The second one, we've started companies called Sim Talks. We do health advocacy and we do health promotion by trying to explain in similar terms what chronic illnesses are and illnesses and the effects, so that people can take charge of their own health. Yes, less have to go to the doctor to understand anything that's health related.
Yes.
Improve by that, because we've come to understand that outcomes improve when you know better, which is what the social determinants of health say. If you are better schooled, you have better resources, then you are likely to be healthier. So we want to improve that by doing the education. So those are the things that we are doing, trying to do for the community as a Kogolwen and the broader community as Mthat, so that we have a prototype of what a rural area should be. It should have a school, it should have a church, it should have an academy, so that the kids can play, the kids can go to school, and the kids can have religion. A person can have the religion of their choice. And you must have a form of economy, whether it's agriculture or whatever it is. We're trying to do that and establish that. Then we can sell it to other rural areas, because for now, people get educated and leave. And that's the saddest part of the rural areas. You find big houses that have only one person who's looking after that house. So
in fact, we left a big house which just got vandalized and people stole everything that you could get. So we're in the process of actually starting to rebuild our family home because of exactly what you said. But I heard that when you decided to go and set up your practice at Kogolweni.
Well, this is what I'm saying. We're trying to change the system. Wanted to set up a practice at Kogolweni. When I went back, I charged fees that were similar to what doctors in the urban areas were charging. But my first client was an unemployed lady whose only source of income was his husband's disability grant. And they had to pay 400 rands for as a consultation fee. And I was hurt because I knew that she had to wait until the month end for the husband to get the disability grant, and then to take some of her provisions and use it for medical reasons, because that's the only time she can see a doctor. And now that 400 rands, now to me, I saw that it was too expensive. So now we have to find a way of subsidizing the cost of seeing a doctor for the person. So now we close the practice a bit so that we can re-strategize. How do we reduce the cost for that lady? Because she wants to see a doctor, but 400 rands for someone who's getting less than 2,000 and living on social grants. That's the issues that we are. So that's why I'm back at home. I want to be there and deal with the issues that are structural.
Ndibuyele nje ku Dr. Nqoza naye akazi introduce because he's been away from South Africa for many years. I actually want him to tell us quickly before singene ke ngoku kusingaye Dr. Tony.
I would say masibele kusingaye singekashiyoli ixesha, but just a quick one. Kulamba waseKalawi wawuhlanga ngondihleka wena uthi ndenza yonke into because opposite the gate yesikolo St. John's, I think most of the people who've been through St. John's in those years would see me on roller skates, football, tennis, every sport that I could get my teeth into. But tennis was the main thing, and at the time we had, I think, a lot of kids who were very good in tennis. But because it was pre-94, that talent was never nurtured, and it was all about go to school. Fortunately, Dr. Tony and I managed to go to school and then take a break. But at the time, that was not the choice for us. But if you remember Fundi, Kwapongwana, Salukazana, Nono Pasik, those people at the time would have given Wayne Ferreira a run for his money. But unfortunately, we were not allowed to participate in those sports. Sports boycott, yes, but the opportunities were not there for us.
So what are you doing in the UK, Doc?
Now, I did have a practice in Port Elizabeth, Motherwell for a while, and then I came to the UK. I'm working for the NHS at the moment, which came at a very interesting time, which is where we are and we're conversing today. But I just want to go back a little bit to Sim Talks, because it's interesting what Sim is saying, in that when I listened to the videos, education was there. Now, this topic about the first patient at 400 Rand, I think you can take it on board. We should come back to it and discuss NHI, because that is the cornerstone of what he's talking about. And then because NHI seems to be something that is taken from the NHS, which becomes difficult in where we are in terms of South Africa in implementing it as is. So it needs to be adapted, but people should not be dogmatic when we say there's a problem here. How about looking at it this way? So I think it's a topic that we could come back to.
Yes, we will definitely come back. All right, thanks, Doc, man. Now, let me just, for the benefit of those people who don't know what the procedures that are relating to funerals during this time, I just want to read through quickly without wasting time. So the funeral procedure during the lockdown, the family, the bereaved family, they apply for a permit for a funeral service. They have to request permission for the service to be held at home and in church, and they need to specify the times. The church needs to be inspected by authorities for compliance. The family must get an affidavit. The family needs to invite attendees, or what we call mourners. The pastor or the reverend have to apply for a permit to conduct the funeral. The pastor must get an affidavit confirming that he's been appointed by the family. The pastor, has to explain regulations to the family, such as no touching of corpse, sanitizing of hands, no touching of the coffin, and all of those things. The undertaker must obtain an affidavit that clearly states the route that will be taken from home to the burial ground. At church, the pastor has to explain the procedures before the mourners enter. There must be an attendance register that's completed. There must be strictly 50 people allowed, no more. And the service must not be longer than an hour. And everybody has to observe social distancing, and there must be sanitization of everybody. There is no sharing of mics. There must be a dedicated mic for the singers and the MC. There must be a mic for speeches, which must be sanitized between the speeches. There must be pallbearers who have gloves. After the service, they must have a designated route to the cemetery, no deviation from that. at the cemetery gate, the authorities are supposed to inspect all documents and take originals, leave copies. Mourners and cars are physically counted, and each car must carry half the number of people, and anybody beyond the 50 is denied access. After the service, everybody must leave, and the municipality must then close amangcwaba, with only 3 family members who stay behind to witness the closure, and the rest of the mourners go back to the house to collect takeaways and leave. No hanging around, no after service prayer for the family, and all permits for that funeral expire. Now, one thing that is written here is that you also need strong bouncers to turn extra people away. All right. So, I mean, if you listen to that list, it's hectic.
Exhausting. Now, before you even ask, Ben, I'm sorry to jump in.
Yeah.
Dr. Tony, the list Kulu ran through. Were you able to do all those things?
I'm Kulu. We had 3 days to organize the funeral. The first challenge we had when my dad passed away. My dad is a community person. Most of what I know, I learned from him. The distance between my place, my home, and the church which we attended every Sunday is 3 kilometers. He used to drive there, but he would take 30 minutes driving there because everyone he met on the road was not going to church. He would stop, talk to them, tell them, why are you not, I need to see you next week in church, or other people would tell them, by the time I get to church, I need to find you in church. So a 3 kilometer route by car would take us 30 minutes to get there. So he was always involved. He would visit people, he would assist people. But when he died, he had a group of about 6 or 7 pensioners that every month end, he would ferry to town to collect their money. He was also on pension, so they would go together, collect their money. And because now of the lockdown and COVID regulations, it meant he had to have 2 or 3 trips. And that he did without fail. And that came naturally for him. And in church, he was a leader in church. So around the place, he was respected. He had also been a principal at Dalingeb, yes, both in the Mandela School of Science and Technology and in the old Dalingeb. So he was well known and well respected. And the first thing that we discussed after we just stopped crying, because we didn't have a long time to cry. We haven't had time to sit and cry. After realizing that he had died and that he had died during COVID, because I'm also on the forefront of trying to curb the spread of infections, I knew a bit about the regulations, but especially relating to funerals, that we don't need gatherings. So the first thing I discussed with my family was, how do we make sure that people do not come home? So the video that people are seeing now, probably this one was unintentional. There's videos that we send out intentionally to say, we understand that the impact that is had in people's lives. But primary to that was to improve the lives of people. So that is what we need. We need to continue doing what he was doing. And coming to visit us is against that. Yes, we understand the need, Yamakosa and Yabantu, that we want to come and congregate with you. But it's contrary to the spirit that he always presented and wanted to further, that let us improve the next person's life. So when you're coming here, you are putting the next person's life in danger. So from the first day, we had to stop mourning and start spreading the message that we realize that the trouble that we are in. We know people who want to come and visit us, but please respect the decision that do not come. So we didn't have time to look at the regulations. It was Saturday when he died. And we had to choose between Tuesday and Wednesday, because if we left it until the weekend, because of his stature in the community, would have had trouble. So we tried to minimize that by saying Tuesday or Wednesday. Having discussed it as a family, we decided on Wednesday. It allowed, because most of my siblings are in East London, it allows them to travel down and come and bury their dead, so that if there's also other things that needed to be done, they had to be done. So most of the things that Ubutfundile is reading are for the urban communities. We don't have municipality Mangcwabeni. Siyazombela, no one does that. And we don't have law enforcers here. So these are things that we're still asking government to set up, because law enforcement, there's no law enforcement as Lalin, there's no community thing. And the rural authorities have almost been done away with. We only have Qeba for a big word, when we used to have tribal authorities and they had a lot of authority over the people. That has been taken away. And as a result now, when we need that, it's not as active. It's starting to be activated now, but those people have been inactive. So these were the challenges, especially when the list that is reading is exhaustive. If we had those things set up, we wouldn't have had the problems that we're having.
Yes.
So the things that you read, they are alien to me, and I'm like,
yo, because I went into your page, in preparation for this meeting, and I saw videos that you created, I think soon after Ninompang, where you were now telling people, please don't come home, to Uzo Tutuza, don't do this, don't do that. In fact, you guys decided to be innovative and come up with something. I don't know, it's a drive-through or walk-through memorial service. I just want the concept of a drive-through, walk-through memorial service. Where did it come from?
Kabantu Gewa computer or IT savvy that came up with that idea, and they had seen it on social media, where because people cannot come in big numbers, because COVID, the main problem with COVID is big groups, because then the virus spreads and it's not easy to trace the contact. So people had seen this idea on social media, that small groups which will be able to maintain social distance can come, and we'll put a place that is outside, because COVID requires good ventilation, and if you're outside, that place is well ventilated.
Yeah.
And if we can do that, allow people to come, because they will protect the high-risk group, which are the elderly and people with comorbidities. Won't expose them to those people, but they will find the rest of the younger people of the family, maintain social distancing. We put pictures of my dad, and we put flags and banners from the church, because the church he was a big part of the church. So we put those things in place so that whoever feels like they can come and say something, they should come and do that. That's something that we can thank the Fourth Industrial Revolution for, because we saw that with social media, and then we took that and said, this is a compromise. But even Ula compromise, we need people to call when they are going to come, because we want to manage the numbers that are going to come, because I
know that very well. I know it very well at the age of 25.
So we did not want to open a window that people are going to abuse. So we try to do that. We don't have bouncers. We don't have bouncers. So we're always pleading with people not to do that. I wanted to come out of here that the biggest challenge I would say we had as a family was the church. And it's a bit disappointing from the church, because we understand the position of the church. When the sorrow, whatever is there, the church are the first respondents. But the church doesn't adapt, because we are in an adapt or die situation. The church doesn't adapt. They don't want to adapt. Yet they are leaders in the community. If the church says we must go left, most of the people who belong to the church, they go left without asking. And now if the church can take up the lead in the communities and say, we understand COVID. No, son. There are no funeral services. There is burials. And a burial, and then we go. A service that's less than an hour. Ayo service, you read the obituary, and kuphunywe kuhambe. When we were reporting that the results have come in and there are people who have tested positive, it was already 3 hours into that service. And
3?
Yes, it was 3 hours into the service.
Because I want us to get to that, because that's the highlight here to your discussion. When you decided now, Uba, you now need to take charge and do whatever that needs to be done from a public health point of view. But drive-through,
I must commend now with drive-through. This is again, I must commend. This is the community. These are people who worked with him. These are people who went to school with him. These are people from around who feel like they must come. The first people who came are my sister's colleagues. They came, stood outside the gate. They say, we understand the regulations. They did their social distancing, paid their respects. My sister went to meet them and they said whatever they wanted to do, to say to her, and gave her the contributions, and then they left. We were pleased with those people because they understood the regulations, and then they left. So this was the idea around it drive-through. And I think it's a brilliant idea, because if you can have a place that's like a sanctuary, Abelungu, they put flowers at that place. And there's nothing, to says whatever they want to say, leave a flower, and then they go. It's the same idea that we are practicing, and that went brilliantly. We want to thank the people who adhered to that.
Yes, and then you announced that people must register for la top 50.
No. The challenges with the church started between Sunday and Wednesday. The church, we understand their position, but everyone wants to come from the church to comfort you. But we did say that not more than 10 people. But if people from the church were coming, there'd be 20 or 30.
Numbers.
As I was coming into this show, there's someone who's tagged me on a post on Facebook. There's a memorial for guilders in Port Elizabeth. And in that small space, there are people who are singing and shouting, others are wearing masks and not wearing masks. And that is a potential epicenter for the virus.
Event.
Yes, because one person who's infected in that group already has spread the virus to everyone who's there. And people don't understand that the masks that we wear, the cloth masks, don't protect as well, especially when you are singing, because you are blowing the wind with a bigger force than just talking. And these are the things, and you cannot come from the church and say, we are not going to sing. That's the first thing that people from church do, they sing. So we try to explain that even the 1.5 meters, if you are going to sing, is not enough. It's not enough distance. So the social distancing is for a service that's going to be short, no singing or minimal singing, then we are safe. The moment you start singing, then we need a social distance of 2.5 meters, and we need to be outside. So these are the challenges when you're explaining to people. And if someone were to explain to, how did we get to 50? When we say there must be 50 people in a funeral, how did we get to 50? Because some funerals are held in small tents, and people say we are less than 50. So we are within the regulations. So these are the challenges now when you start telling people less than 50. But we are a big family. Ekaya, we have 3 homesteads around my home that belong to our family. So the number of people already around our home is 30. So we only had space for 20 people from outside.
And that's the church.
Yes, and plus the church. And we started including people, and we said we are going to represent the households from outside, because kukon is izukulwana and relatives and abakwenyana. So we had to do that, one person from each family, one person from each family. We need only 3 people from the church.
You can never
see that as a snap. They'll see that as a snap.
Yeah. And they felt snapped, and they felt snapped, and they felt snapped. And we decided that there's going to be the burial first before we have the service where there's people, the speakers. So from the mortuary straight to the gravesite, fortunately it was, unfortunately, I thought at first it was fortunately, but now I've come to understand it's unfortunate. Fortunately, it was inside the yard, a garden.
Yeah.
So we came through, went to the garden. That one is an open service. The garden is big. People practice social distancing, and there weren't many people. And we finished with that part. And we had someone who was reporting the numbers. He reported that there's more than 50 people inside the yard now.
Yo.
And we need to do something. So before that service started, we stood up and I said, there's more than 50 people. And the people are supposed to be inside the yard. They have been indicated to that you are invited. These are the people. And we know them because it's the same, except the 3 from the church. And I can name them now. I know them. So I did say that this person and this person are expected. These other people are not expected. And people were defiant from there.
The gate crashers.
The gate crashers were defiant and they didn't leave. There's a few family members who were decent enough who stood up and left. And those people I do appreciate and applaud, because when we said, unfortunately, family, we understand you want to come and visit, this is your brother, but we cannot for regulations. And then they were decent enough to stand up and leave. But there were people who decided we are not going to do that, we are going to be defiant. As a result, for most of the part, I didn't see my father's funeral. I'm still going to watch it when I see the video. I was outside because I felt if there's 55 people inside, I need to reduce the number and make it 54. So I stepped out and I went outside. So it continued. It started exactly at 8 because we had planned for it to start at 8. Started exactly at 8. Then I didn't think of calling law enforcement. I think that's the biggest mistake I did. I should have called law enforcement because there's a public health risk that was there. But I don't know why I didn't. While I was standing outside, I got a call. Dr. Tony, we've been referred to you. You know the people were tested. These are the results. They've come back positive. And
this is now the family members.
The family members, yes, because my dad was infected. And that's the reason we said people shouldn't come. We always expressed it that my dad was COVID positive. So we do not want people to come because we have PUIs here. And this is why we're protecting. And we might follow social distancing, but when you come for a funeral and to visit people, there's a break in that prevention, in those prevention measures.
Yeah.
So we don't want to put people at that risk. So when the results came and they were positive, I didn't want to go.
During the actual service.
During the actual service. And there was a colleague of mine who was with me, Dr. Nolob.
The lady.
Dr. Nolob.
Yeah. Yeah, there was a lady who was standing next to you.
Yes, Dr. Nolob. She said, unfortunately, as heartbroken as you feel and whatever you are feeling, there's a public health risk that is going on. We need to go and intervene. And now you stop grieving and having sadness and being angry. You have to intervene because the community is affected. And now it's become an epicenter for COVID, the home. So this is when we went there. We started first by informing the people who were affected that, guys, the results have come back. Fortunately, those people were respecting the PUI status. We say that you are
just for PUI, person under investigation. Results.
Results. So wear your mask at all times. Remember to sanitize, keep your distance from people. So they were maintaining that. So that this is why we wanted less than 50 people, because we procured a big tent and made sure that we can put chairs with social distancing for 50 people. In the moment there were more than 50, then we were in trouble because we couldn't maintain social distancing. Then we had to come to the service and say, this is why we had asked people to stay away, because we know there's a potential that we might start spreading the virus. a primary person was infected, might be dead and not here, but he could have spread it to other people. And unfortunately, it has happened like that. It has spread to other people. And it means by us not maintaining social distance because of the numbers that are inside, it means we are already at risk now. And because there's been a lot of singing and there's been a lot of ukushumayela, now we are at risk now. And we need to stop immediately. And people must understand that they are now also PUIs. It's either they sit the 14 days for quarantining, waiting for symptoms, or they test after day 8 if they have to go back to work early. So that's what we had to tell them, that now it's changed. It's starting to affect you adversely. Now you can't continue with your life for the next 14 days. These are the things that we're trying to prevent when we're saying, please do not come. Please do not come. It's not for us. We are already PUIs. At home, we're already PUIs. We are protecting you as a community.
So how was it taken by the Mourners? In Mourners, as you were announcing of money results, and you know, people have tested positive, you mentioned people's names there, you know, that is family members, you know, obviously with their consent, you know, like how was that received by abantu babepha in the service?
Fundile, I want to say that there was no consent seeking, Payana, because in a pandemic and there's more than 50 people, we know that we've broken a chain of prevention. So we didn't know who has met who, and we had to get people to classify themselves. Am I a high risk? Am I a low risk? Am I a risk? Am I a contact? And we had to say that people were infected so that you can look around and say who was next to me. Because if we say there are people who are infected, you don't know, you might say I was not next to the people who are infected. So we had to mention, because you must categorize yourself, am I a contact? So we had to do that and say that.
What I wanted to clarify when I talk, sorry, man, for the benefit of people who are listening, I wanted to, but in the doctor-patient confidentiality, one of the grounds to break it is when there is a public health risk. Right? Public health risk is one of the grounds for breaking doctor-patient confidentiality. The other one being consent to, or the other one, court court. So in this instance, public health considerations were such that you guys had to break that confidentiality.
Now, sorry to interrupt, Dr. Tom. Now, Fundile, this is where I got this, because Cindy Legama on the phone says to me, Dr. Tony Kobolweni has done this. I'm thinking, what's going on here? Let me see all the videos. I want to see what you are talking about. And then I had a look at them, and I felt this is something that is so commendable. For someone to be grieving, but be still thinking about the community at the same time. So I put all of them on my timeline, and the response was immense, which is why I got his number and I called him, not knowing him from Adam. And he received me very well and said he wants to continue to educate, which goes back to the SIM talks that he was talking about, because community is at the forefront. Educate the people. And he sacrificed himself in his time of grief for other people who were not adhering to the regulations, to make sure that the message, so which is why in your platform as well, it's important that we take his voice and amplify it and put it there so that people can know. Now, this is not a statistic. This is a person whose father has died, who he was burying, but people still did not want to listen to the regulations.
So Payana, we did that, and we were well received generally. I want to say that we were well received because of my relationship with my community. I know most people, and I was working there for FPD as one of the contracted doctors. So the relationship there, especially on health matters, they trust my instinct and they respect me, and they receive that. And where we have had problems, it's always easy for us to correct those when we deal and talk to each other, because we're able to do that. But at that moment, what people needed to do, which Dr. Nolowa did very well, was understand the protocol now that you are a contact, what needs to be done. So the first part of the video, Dr. Nolowa does that. She explains what the protocol is relating to COVID. Now that you are a contact, this is what is expected of you. Please stay at home. And unfortunately, the policing part, which is the law enforcement, is still lacking in our areas. And it's still people who are self-motivated who do it. Other people who do not care, they don't do it. And having sat in some of the meetings, I understand the law enforcement officers when they said, when the lockdown regulations were relaxed, then they were almost handcuffed, because level 5 was the best for them, because people were told not to move. And as soon as it was relaxed to level 4, then anyone could always say, I'm going to work because of this, or I'm going to get izinto that we need at home. So there's been a challenge with law enforcement with the relaxed lockdown regulations. But again, as we had said earlier, we don't know the people who are making the regulations, the difficulties that they sit with. We can't speak to that. So now we have about 60 to 70 people who are contacts, and then they must go and quarantine at home. We do not know how many are doing that, which is why we did not want to have any people as contacts, because to have 70 and expect 100% compliance is being ridiculous.
It's not possible.
It's not possible. So we are likely to have people who are contacts who might be positive after a few days, after 3 days, and then start spreading it because they are asymptomatic. I have to mention this, that kukhona umama omdala wasekhaya. She was almost homebound. She didn't leave the house unless someone took her by car and take her to town. And for the past 2 weeks, she hadn't left the house. I think 2 to 3 weeks, she hadn't left the house. But she tested positive at the same time with the rest of the people who tested positive, which means there's someone who went out and brought the virus into the home. And this is why we're telling people that you will be asymptomatic when you leave the funeral. It's not you who's going to suffer, it's the person we are staying with. And they are going to get COVID when they are staying at home. This is what we are trying to tell the people who are mobile, that we are not protecting only you. And as a result, we are losing a layer of our generation as Black people, because if you lose the over 60 people, then we are starting to lose the expertise of that group. And these are challenging times when we need them. And this is the reason why it was not easy for me to forget that we are grieving and there's a service, but there were more important things to think about, that we are losing people. And unfortunately, I'm also employed at Mthatha Regional Hospital. I know the PUI ward is full. I know the COVID ward is full. So a person from around Mthatha who needs to be admitted into the PUI or COVID ward will struggle to find a bed. And we're starting to get people who are dying outside or must be transferred to Mthatha Hospital in Barnabas. Must be sent to Zitulele. And this is why then it was important to teach. It was a teaching opportunity, and to try and to implore to people that we're going to have a funeral again, a burial again. Let's not make the same mistake that we have done. I didn't know it would go viral. I had expected that my siblings will tell the people who were broadcasting, because all we wanted to do is to broadcast the funeral for Abantu Bakaprapet, because they couldn't come. So I thought in my mind, after I had done that, I had thought that the video would have been cut when we started speaking about that. I didn't know it had gone viral until people started saying there's a video.
No, in fact, Doc, the first copy that I saw was on the timeline of a lady who used to be in the presidency, I think now she's with the School of Governance, Lakela Kaunda, all right? And she was, she had written about it as one of the best awareness moments, around Indaba COVID, in a situation near funeral. And later then, Dr. Bov showed me the videos that Dr. Khosani had put with Twitter, which were much more professional. The one was made by an amateur with a cell phone. Yeah, but it was audible enough for one to be able to follow what was happening. Yeah,
so
yeah, Doc.
Ziyambulela Keith, because it was being broadcasted by UKNR radio station. Yes. Ziyambulela. Now, if I was the one obephayana obefota, I understand into the health, I would think kukoni controversy apa, and I don't want to broadcast it in regard. But I think he saw the teaching moment, and I hope that's how it is going to come.
No, it came through as one of the best teaching moments. It's real, it's happening in a funeral, and the person who is doing it is very knowledgeable about what must be done, what must not be done, and in fact, somebody even wrote that they wish that those clips of yours could have been put on SABC. That's how powerful they were, because then it makes it real, and it's heartfelt, and it's serious, So I'm sure that there will be some approaches from some of the bigger, broadcasters, to follow up on those videos, because it really was, for me, even nam it really was real. It was powerful.
I spoke to him on Saturday, and I said exactly that this needs to go out far and wide for exactly the same reason, a teaching moment. Yes. So he has had some calls from people. So it is going to be reported. And the important thing is it's his voice. Yes. It's his home. It's his funeral, his father's funeral. So, and it is the community person that he is, where this thing is so important, because it's community first, thinking about the people, selfless, because he's grieving.
Yes, or somebody else could have chosen to say, this is our grief, let's focus on our grief, to hell with what happens elsewhere.
Exactly.
But he actually decided, Doc?
And by the way, that is happening when I better, because you see, there has been instances where leaders in terms of political parties are announcing results, but there is no talk of self-isolation while waiting for the results. Because that, so this leader was somewhere, all of a sudden they've got a negative, not detected test result, but they're not saying I am in self-isolation. Because it's important that the people that were with you know, so that they can also self-isolate, as Dr. Tony has said. 8 days test if there are symptoms, 14 days if there are no symptoms. But you need to be responsible. And unfortunately, our leaders are not responsible, which is why the message doesn't get across. Now, imagine if what Dr. Tony is saying is being said by a political leader. As you mentioned earlier on, I'm not sure whether we're on air, when Nelson Mandela stood up and Mr. Mchelezi stood up and announced their situation during the HIV era. We are not getting that at the moment, and we need that leadership. And speaking of funerals again, your friend, the chief, came out a few months ago and said, we need to bury our people. This is our culture. Now, the people that follow him continue and go to funerals in large numbers. And yet, Simtandile, in his situation, is trying to stop that. So the chief has got more pull. His voice is louder and has got more reach. Yes. But he is not acting responsibly.
Yes.
Communities, this is my plea to the church. The church is a leader in the communities. It's a leader in the communities. We're not attacking it, but we're asking it to step up and say, preach about Kala. When Amasrael were about to leave Egypt, Waguku plagues. And what happened is the church prayed inside the houses. So Ikawe doesn't have to come out to be Ikawe. They can pray at home. They can pray as individuals. And especially in Gokukukona, virtual media, we can do these things. We can set a time and pray there. And the church can do that. And they don't have to come to the home to visit. They can say, please set up for us Zoom, then we meet there and we do that. And the church can do, if the church can step up in the fight against COVID, that's the first community that needs to step up and say, we are going to do this. If the leader of the church, which is the reverend, is in a funeral and it drags for longer than an hour, he must stop the service. He cannot say we are waiting for other people to do. He must tell the family we are stopping the service because the laws ask of us to do that. And secondly, there's another community that if we can speak to them nicely, I don't know, they are still having troubles with Minister Mbalula. If we can tackle the taxes, if we can deal and talk with those people, because they are ferrying our people, unfortunately. You step into a taxi, and you find a driver not wearing a mask. And the moment, and unfortunately, we stop them when we see them, but you can only see this person.
Just a little bit, Doc. We will extend by about 15 minutes because we're supposed to end at 5. Is that okay with you guys? No, it's fine. I just wanted to ask for your permission to just extend by 15 minutes.
Okay. Onoteksi ufika benganxibanga mask. Unoteksi uyibeka kule ndawo mask so that xa kuvela amapolisa they can put on the mask. If we can share the message with them and say you are critical in the fight against COVID. These are the groups that have been left outside of the fight against COVID because COVID is being fought by the national office, is being fought by the provincial offices and by the mayors. But the people that matter who carry our people the taxes. And last but not least, this is the very, I don't want to say troublesome group. This is another group that's causing us problems. The people who drink in the shippings. As I was driving to town, because there's no network at Kokolweni, along the street, I saw Abantu, they were sitting there and sharing beer and drinking. They are going to become infected and go back home. And they're older than 60, they have diabetes. And these are the people that bring COVID into the families. So if we can target those three groups for if we can target those three groups, then we would be in a better place in our fight against COVID.
Yes.
The electricity just left so
we are but get dog. Yes, no, even if we listen to your voice in Joanna Kondo, we're going to wrap up very quickly. So the issue of alcohol is also another big problem. Shebeens and places like those, because then people don't observe social distancing and prevention measures.
Yes, and I think people don't understand because there's no immediate risk to yourself. There's no immediate punishment for not following the regulations. Chances are they won't even fall ill. So when you go and drink and come back, you do not know why people want you not to go and drink.
Yes.
But then when you realize that you are putting the other person, so we need to go and start engaging with them. We've marginalized them, we're not engaging with them. And this is what I will be talking about on Umhlobo Wenene tomorrow at 10:10, to say what is the community response, because our response response has been high profile. It is led by the national office and the provincial offices, but we need to start engaging Ezans. So we have to move into the shippings, make the shipping owner understand that when you sell to people and then you let them drink around here, then you are sure spreading. Encourage people to go and drink at home. If you cannot sell, do not sell. Because the fact that we have been told that we can sell alcohol doesn't mean we should sell. So this is the that we're going to be selling.
Doc, I understand our president is talking tonight, and amongst the things that he's going to be addressing is the issue of the taxis that have decided to go to 100% capacity. And the second one is actually the issue of alcohol. So let's wait and see what in the next few hours. But my worry is that, you know, like you were saying, we need to engage rather than just, you know, use the full might of the law. Yeah, but yeah, we need a carrot and stick approach. Yeah, because you know, abantu beteksi abamameli kakuhle and ngamaxesha ke ba quick nokufuna, you know, they are quick to be violent at times, you know. So we hope that whatever is going to be announced will be something that will make them to think twice about breaking the law. But anyway, Dr. Khosan, you are sitting in the UK, in Manchester. By the way, our team is doing very well. You know, it's doing very well, and Chelsea did that in favor yesterday. I hope we win tomorrow so that we can be in the top 3. But looking at South Africa from the UK vantage, you know, how and maybe doing a bit of contrast with the UK, just for the next few minutes, a quick one.
Now, Dr. Tony touched on this earlier, and it's a pity that we're meeting now, because what his ideas around this are the same as mine. We needed to lock down early. And I said it, and unfortunately, I am very vocal. I am not afraid.
Yeah.
And then I got the fearmonger, Twitter activists, and all the labels. That was 3-4 months ago. Now, as you say, it's a vantage point. I'm sitting here, I'm looking at the numbers, I'm looking at the deaths. Now, obviously, I've got to think about South Africa, because here you've got NHS, Nightingale, London, Bristol, and Manchester. Those are units that got put up, and they had ICU beds in readiness of the peak. The acute hospitals had to shift wards around and make space available. 3 wards empty in readiness for patients. All those patients get stepped down, and then from the step down hospitals, they go to the community, all waiting. Now, when you are in lockdown, that's what you do, you prepare. And then you've got the situation of PPE, which people, nurses have been talking about, doctors have been talking about. But unfortunately, and I've been saying this, when Nehao and Denosa are talking about PPE, someone needs to ask them clearly, break it down. At what level is what being worn? At what level is what being worn? Yeah. Because in aerosol generating procedures, you know, you need your FFP3, you need your full gown, because the chances are higher there. But now South Africa is...
It's like when you are incubating somebody, ventilator, the chances of infections are higher there.
So you then need an FFP3 and a full gown and all of that.
And N95.
Exactly. But in a general ward, you need your apron, your gloves, and your mask, and your goggles sometimes too. But now we have here, not here, but they call it Black, Asian, and mixed and minor ethnicities, BAME.
Yeah.
We have... that is where the most mortality has been. And I have not had sight of the report yet, but when it was talked about in the news, Bangladesh nationals were the highest. Now, that is very important, because in the Eastern Cape at the moment, the healthcare workers that are dying, the number is very high, and it's mainly nurses. Now, if you don't do those risk assessments with them, you are not going to understand why the mortality rate is high. It's high because for some reason, Black people and minorities, which in South Africa, again, is not going to be clear, because the majority of people in South Africa are Black. But if you look worldwide, the majority of people that are dying are Black.
Yes. I had a similar situation with the US people about 3 weeks ago. We were discussing the same thing, that there's a disproportionate amount of infections and deaths amongst the minorities across all the big cities of the US. And it points to socio-economic circumstances.
Exactly. Diabetes, hypertension, obesity, and all the comorbidities. Now, you then go to health. This is where the major problem is. And maybe I'm slow, Bella, but I don't, maybe Dr. Tony can jump in as well. I don't understand why, if you have conditions naturally in medicine like C. diff, ESBL, CPE, where you need barrier nursing. So where were the hospitals procuring that PPE? Just that now local SMMEs must benefit in procurement. What was the procedure then? Why can't you just go to 3M and buy in bulk and arm your staff and work? Because you've got people from the health department saying nurses don't want to work. That is not true. Nurses want to work, but give them the attire, give them the material. So if we had to have a risk assessment, and then it was said, because we're a minority here, we then say, you cannot work in that ward, you cannot work in that ward, you work there, or if you work there, let's give you this. But if that is not happening in South Africa, then you see the incidence of the mortality in Black nurses. Because if you give them a surgical mask and that's it, they are going to get infected. And unfortunately, the numbers are saying that.
And even, in fact, even the procedure of donning and doffing, wearing these things and taking them off, there's a way it must be done. And sometimes human error is a problem, especially now, in the doffing part.
Funny you should mention that. Dr. Don, do the hospitals have infection control nurses or infection
that
control
was going to be my input, Mkulua. I think this is a legacy in a good way that we are going to get from COVID, that our OHS and IPC will be strengthened, because the COVID pandemic found us lacking there. And they are central to the response to COVID. If your occupational health and safety statutes and infection prevention and control are not up to scratch, and this is what you find. And tea rooms, they've just been a source, because it's very difficult to break the culture that's been set there. And it is like now that the only contagious organism is COVID. We've had contagious organisms for COVID. So we should have had this set up much earlier than COVID. And when you find that a hospital is affected, like there has been no infection control, then you see that we're very far behind. So only now we are starting to set up, and COVID is already here. This is why we are lagging behind. And OHS and IPC are the problems that we're having as institutions. And you're finding people are getting infected in large numbers because of that. Our tea rooms are small, our waiting areas are small. If you look at the ventilation in the hospitals, you see that it is not up to scratch. If you look at the notices and the notices that are supposed to encourage people on the safe measures to reduce infection transmission, they are not air. And you find that we only have air conditioners in places where you should be having extractors. So these are the challenges that we're having, especially with IPC. This is what I've seen in public. This is
Thank you very much. That is very important. And then the other thing is shirt and tie, white coats, because with infection control, if you've got the procedures in place, the elbow to the arm to the hand must be free, so that you can wash from the hand to the elbow. And it's important that you wear scrubs, whether the authorities don't like it or not, but scrubs will help, so that they leave you free and you can wash properly.
So when I talk, Dr. Khosani, so from where you are looking, the issues around the primary responsibility of the employer to provide a safe and healthy work environment for their employees is an area that needs to be given attention.
Very much. And Dr. Simtandile just said it now. The infectious conditions are there, but now what was happening pre-COVID? If we have got nurses crying about PPE, something has been like, and I always quantify the 10.1 million of the Ambugirivas is how much PPE can you procure with that? If you were having that discussion pre-lockdown, because the Harlem Society, he told us, I was negotiating with the government for this contract pre-lockdown. So pre-lockdown, Eastern Cape Health was busy budgeting 10 million for those things. 10 million that could have gone to the labs to facilitate 24 to 48 hour return of blood tests, of swabs.
Yeah.
that could have procured adequate PPE.
An indication of our problems is the number of hospitals that were prohibited by the Department of Labor. And I want to say that if the Department of Labor had enough assessors, maybe most of our hospitals would have been prohibited.
Now, on that one, sorry, on that
I'm
one,
saying,
Frey was assessed by labor and was deemed not fit for service. But my issue is, if Frey is not, or Cecilia Makiwan, then no hospital in the Eastern Cape is fit for purpose.
Sulenkamas, Tulele,
there you go.
Holy Cross, those kind of hospitals, St. Barnabas.
And by the way, things that the department we're assessing is, will you be able, and when the department was assessing, it was after the hospitals were allegedly ready to accept patients for COVID. And when there were simple guidelines that the Department of Labor was looking at, you have adequate PPE. If you have it, you have a register for that. Have you trained your people? And do you have sanitizers? And these were simple measures that could be put in place, and we were found wanting. And these are the challenges. It's challenges we have. I'm hopeful that post-COVID will be in a better place as the health system because of the COVID pandemic. But unfortunately, we will have had a lot of casualties.
Yeah. I think another area just on these PPEs, colleagues, is the issue of the efficient use of the supplies. Ungoza did speak about, if you are in a general ward, this is the level of PPE you require. If you are in an ICU where you ventilate, you incubate people for ventilation, this is what you require. Some of the info I got was that people who are in general wards are actually demanding the full gear, and then others are hoarding the stuff, for their own little ward, meaning now inventory control is a problem.
This is a difficult area, Ben, very difficult, because that's why I tried to assess it from the BAME category. Because if you look at the demographics of South Africa, you'll find that the majority of the nurses are Black. So if we, as you said, you had a discussion with the Americans, I think it was in the South and New Orleans area, Louisiana, where the majority of deaths were. So if you do proper risk assessment, you will find that the nurses in the general wards will then need the full gear because she's 55, she's diabetic, she's hypertensive. So if you want her in that ward, give her the necessary material. That is the unfortunate
risk profile.
Exactly. So if you don't do a risk assessment, you will then dismiss the nurse as being irrational, which some people with big names have said, and I was cringing when they said that, because if you don't, you see, there's one thing I don't understand. Denosa, Nehau, and Eastern Cape Health, how are those people not finding each other during a pandemic? I will never understand that because they need to be working together. I'm not mentioning the doctors' unions because they're part of it as well, but you need everyone pulling together to be able to win here. Now, if the nurses and Nehau and the general workers and the porters are complaining, and then you are talking down on them, like we were saying earlier on, that you need everyone on board. You cannot run a health system when you're fighting with the nurses. You are going to lose.
And in fact, I mean, they are the backbone of any healthcare service.
Yes.
So, those are the first line people. They spend more time with the patient than even medical doctors do.
Now, do you remember that article that said another problem we need to be looking at in the spread is the amount of time you are exposed? Yes. As you said, they are the ones who are exposed more, because you can walk in, stand at the foot of the bed and say, okay, what are the sets, what's the news, and write whatever and walk away. That's hardly 5 minutes. But the nurse will be there. The healthcare will be there. The person watching the patient will be there. The porter transporting the patient to X-ray and back. They're spending more time with the patient than the doctor. So when they are saying, we want this, listen to them, talk to them, understand and do a proper risk assessment.
Yeah. Dr. Tony, usekhona?
Hello.
But before you say that, I know we've been focusing more around the issues, as relating to the awareness and everything. But from a grief process point of view, it seems like, because there were so many things that were on your shoulders as a family to make sure that Nenza is sent off kakuhle and there is compliance. Do you think as a family, the grieving process, because you even spend more time outside of the tent, than ngapakathi? Are you considering some psycho-emotional support, after yonke lento,
Unfortunately, I've been offered a time off and I've been offered the psychosocial support. And my family, extended family, they've been very supportive, and we've been supporting each other also as the nuclear family, who unfortunately are all PUIs and are in quarantine as we are speaking. So we haven't had time to grieve our father as we would have had done so. But the first thing that we spoke about was that these are abnormal times. We have to understand that you can salvage a person who is as mild depression, or if they are still alive. But if someone contracts COVID and probably dies or gets a respiratory illness, which she or he will have is sequela, then it's difficult to come back from that. So we've spoken to each other and say we must support each other virtually. We will get time when COVID is over, because unfortunately the pandemic is continuing, whether we try and grieve or not. So let's keep ourselves safe at the moment and try and support each other. And when the time is right, we'll get the necessary interventions. That has been the talk of the family. Unfortunately, at work, I've been offered psychosocial support that whenever there's a need, I feel overwhelmed, I should take time off, and there's people to support me. And I'm grateful to the Department of Health in the Eastern Cape for that. I'm working currently at Mthatha Regional Hospital. Yes, so I've been offered that. I'm thankful for that personally. And the family, I think we are taken care of, although we haven't grieved. And I hope people whose relatives and parents pass on will understand that part. Because emphazweni isijoni ubulele eqala kwalo alifile ukhangela indawo yokuzimelisa, so that when the war is over you can come back and check. Otherwise you run after that and go to a safe place, because we need to keep each other alive as many as possible. On the other side, then we can start ukukhothana manxeba.
No, those are very powerful words. Dr. Khosani, your closing remarks. I
want to again say thank you to Dr. Tony for his sacrifice and for being able to put us in your platform with your reach, and him also continuing on Umhlobo Wendene and all the other print media that will make contact with him, so that people, when you're talking about COVID, the death, organization of a funeral, people actually have seen someone, have heard the voice, and have actually understood what he did, why he did it, and how it's affected him. Now, if you then, beyond that, continue with life as normal, there's nothing else we can do. As the president has said, it's all in your hands.
Yes. With those words, I call you Ngoza. Dr. Khosani, thank you, man, very much for joining us, from the UK. It's nice to also just see the face rather than the tweets, just see the face and see that now the man is still okay. So okay, ungukhatebe mos, ungungelengele ndlebenhle zombini. Siyabulela man kakhulu, siyabulela kakhulu kweli cala lethu apha eMzantsi. Ubulise nalapho kuMamekaya and the young man, does he still have the threads, or you have to cut them now?
Ah, well, you need to watch the Gillette advert. You're not watching football. You'll see.
Okay. But anyway, thank you very much, Mantok, for giving us even more than the hour that I had asked for. I'm sure it's not the last time that we are talking, because I've been dealing a lot with the US people, but it would be nice to also have connections in the UK so that we can compare notes about this and that. So it's definitely not the last time that I'm
especially SIM talks on the community and NHI. I think we can build something from there.
Yes. No,
thank you very much, Dr. Ton.
It's an honor to sit amongst you. I think 2 years ago, wellness in Toronto, college weekend. I met him there. I saw him. I've been following him.
Oh, yes. And again, the Tata General, especially.
Resource center, yes. Ndiyambona kancinci kusisicoceka mfundisi. But andimdanga ku-Twitter, so I'm going to start ndibone ku-Twitter.
No, you need to have a thick skin to be in Twitter. So I'm there, but I'm a ghost. All right, Dr. Tony, I want to also, just convey, firstly, heartfelt condolences to you and the family. Kuthiwa liduduma lidlule. So kuzawude kulunge wena, nibambane as a family. But thank you so much for sharing about pain ye family yenu and the constructive way that you have dealt with it, not only looking at your nuclear family or extended family, but also looking at the health interests of the broader community. So thank you very much. I think you are a generation, or you part of the generation of young doctors that actually are there because of a calling, because not all of us who are in this space are there only for those reasons. So by you actually being so engrossed with Lalin, it tells you're not driven only by financial reasons. So for that reason, I just want to thank you. May you continue, and where I can be able to be of assistance, at least now we've got numbers. You can talk to me. Now I can see how to help, but please, usibulelele kuye wonke umuntu who made sure ukuba nineligalelo nilenzileyo, and all the best tomorrow kumhlobo wene.
Enkosi kakhulu bakhulu bam, ngiyabulela.
Yes.
And I missed the Grand Prix today. The second one in Austria. That's how important this conversation was.
I'm sorry, man. I'm sorry. But anyway, thank you very much. Thank you, colleagues. Thank you very much. Thank you to our viewers as well who connected and listened to this conversation. I hope you picked up one or two things that will also help you in the event that you go through a situation like this. Thank you to everybody, and may you all stay COVID-free. We live in difficult times. Make sure you keep that social distance, wash those hands, keep that social, that cough and the sneezing etiquette. You're not doing it only for yourself, but you are doing it for all the other people that you love. Thank you very much.
Thank you.
Right.